Welcome to this week's podcast of Kickin It With Kidneys with your host, Cindy Barclay. Hey, Cindy, take it away.
And hello out there. Welcome to Kickin It With Kidneys, a forum to discuss important topics for suppressed voices within the dialysis community. A part of Kickin It With Kidneys' mission is to provide our listeners with information and suggestions to help them become their very best advocates and to increase awareness and education of community issues that influence life's opportunities. Now, this episode will continue with that goal by helping CKD dialysis patients and their families maximize quality time spent with healthcare providers. We will also explore what patients should expect from providers during appointments and what to do if you feel that you have not received effective care. So, we have joining us today on our panel, Maria Jimenez, Rita Williams, and BJ Simone. So, BJ, what is the word on the street?
Well, this week we have another probing question from our dialysis patients, and this one is a universal question that we all could answer. So let's take a listen.
The word on the street with Simone.
Hey, Simone. We're out here today talking to dialysis patients, and we asked them, do you feel like your healthcare team reflects your ethnic background, or does it matter? Here's what they said.
It's hard for me to say because of the fact that, like, I'm in an ethnic environment, but my team that I use is not really part of this environment. You know, if you went to school and you got, you know, your credentials, that whether you are looking like me or not looking like me, I'm looking at your credentials. I'm looking at, you know, how are you rated among your peers? How did you do on the board? You know, who did you get your certification from?
Yes, my healthcare team reflects my ethnic background, and it does matter. I do it deliberately.
It matters to me, and mine does, because I select my healthcare team.
It doesn't matter to me. As long as they're giving me professional services and the correct services, I'm okay with it.
Well, all right. So what do you say, BJ?
Well, I think this is a complex question because we all want the best health care that we can get, no matter who provides it. But part of having good health care is having a provider who understands us on a personal level, so that whatever treatment plans they make and however they communicate with us incorporates the whole person and not them just checking boxes for a condition.
All right. You know, people of color have challenges in navigating the healthcare system, and there are other hurdles that aren't completely within our control. It's called unconscious bias that healthcare providers have that significantly affect assessments and treatments of minority patients. Without effective communication on both sides, the risk of complications and non-compliance increases significantly. So, Maria, can you provide any examples of medical racism that was verbalized to you from patients that you care for?
Well, for the most part, I would have to say that the care that my patients get are equal. What I do see is the questions that they're not asking. A lot of times they'll go to their doctor's office and they'll be like, oh, well, they said this, but I'm not sure. They don't get involved to ask those questions that they need to answer. So my personal experience with patients, I have not had anyone verbalize any biases. I know they do exist, but I haven't experienced that with my patients. More so I hear them not being as involved and asking the right questions that they need to ask.
Well, how do they know what questions they need to ask?
Well, I mean, that comes from getting educated yourself. You want to know if you're put on a medication. Why am I put on this medication? What are the side effects of me being put on this medication? With dialysis, why am I starting dialysis? That level of understanding, you have to advocate for yourself to get. The information is there. I just don't see patients reaching out as they should and getting those questions asked and answered.
So BJ, let's back up a bit. What is the definition of cultural competence from a medical perspective?
Okay, well, I think the first step to understanding cultural competency is to understand what culture is. And culture is all of the products that a group of people can make or produce. And that includes their values, their beliefs, their language, their food, their religion, their clothing, how they interact with their other people of that community, including their jobs that they may have. So cultural competency is the efforts of a system. In this case, it would be the healthcare system through the providers to make sure that their attitudes, their behavior, and their policies understands and accepts that the people they serve have a diverse culture or a diverse group of people. In other words, this is an understanding that you cannot apply this sort of one size fits all. You can't apply the values of one culture to a whole nother group of people.
Okay, so what do you recommend? What are the things that patients can do to facilitate better communication with their healthcare providers? You know, there's a language barrier with a lot of the medical doctors, you know, as far as understanding cultures, you know, primarily.
Yeah, I agree with you. Well, there are some simple things that the patient can do. Now, obviously, there is a mandate for healthcare providers to understand this. You know, we saw this during the COVID pandemic. There was this understanding that there's a disparity among communities of color in healthcare. And I think that increased this awareness that you can't just assume that everybody's going to relate to things the same way. But there are a few things that I do want to share for our listeners and our viewers that they can do. The first thing is to write down your questions and your concerns. So even if there is a language barrier, having it written down can go a long way to helping your provider have common ground. So write down your questions, because there is going to be a limited amount of time that you have with that provider. So you want to make sure that your priorities are being addressed. The second thing is to document any patterns in your problem. Whatever you're there to see the doctor or your provider that day, jot down what the complaint is, when it happened, how often it happens, and be as detailed as possible. What have you done to try to treat it? The third thing is to have the provider explain anything that you don't understand. If you don't understand it, ask that person to repeat it. And then you repeat back what you thought she or he said, so that they can either correct or confirm that you have the right understanding. One of the things that we have that people don't necessarily use, but with your provider's agreement, every cell phone, even the most basic cell phone, has a recording feature. So you can use that as a tool. Also, have them give you additional information in writing, so that when you're in a comfortable environment at home, you can go back and review it, and you can share it with your family members and get some feedback from them. The last thing is, depending on the type of visit that you have, it would be good or advisable to take somebody with you. This is really good when you have a consultation visit. That's when you need that second set of ears.
Yeah, I think Rita kind of expressed that in some of her communication. Continue.
Yeah.
I'm sorry.
And so the last thing I want is that there are many other things that patients can do. And we have that on the Kickin It With Kidneys website. So I want to encourage our listeners and our viewers to go to our website, because there you can download a copy of a PDF of a portable pocket health guide, or you can get instructions where you can order one, so that you can have a hard copy. It's a great tool, so you can write down any of your health information. You'll be able to write down results from your most recent tests or exams. And then they actually will give you sample questions to ask your provider, so that you'll be able to improve your communication with them.
You know, Rita, as a social worker, you deal with a vast majority of different languages and barriers, and you name it, you have to deal with it. So what do you consider to be basic information that healthcare workers and advocates need to know about working and communicating with minority groups?
Yes, effective communication goes a long way, which is very simple communication where you actively listen. You listen twice as much as you speak. The old saying is we have 2 ears and 1 mouth. So, you know, we listen twice and speak once. Nonverbal communication. Be careful with your nonverbal signs. I mean, I tend to roll my eyes sometimes. My facial expressions are all out there. So you need to be careful with that. Ask questions, you know, show interest when you're asking them things, you know, ask questions, be clear, speak plain English, leave the colorful language for
I hear what you're saying, speak plain English, Rita, but obviously a lot of people, even our medical doctors, a lot of them are not speaking clarity with their grammar, you know, they have strong dialects, you know, strong accents.
Right.
And it may be hard for the patient. The patient won't come out and say, I didn't understand you. They don't want to offend the doctor instead of understanding that they're on your payroll, you know?
But I mean, and like Maria and BJ said, we have to empower our patients to be able to say, doctor, can you repeat that for me? Because they sure, if one of my Spanish families goes in there, my Spanish patients goes in there, they're real easy. They usually ask, hey, can you repeat that? Or what did you say? Or what did you mean? Ask for clarity. You know, clarify. One of the other things we need to make sure is that they're clarifying and you're summarizing. Make sure that you heard what you heard from the patient. One of the other things social workers or people working with our patients need to be empathetic. They need to provide some feedback and then develop that trust and rapport. When you say you're going to do something, do it. Just don't say you're going to do it. If you say you're going to call me back, call me back. And also be present. Like Maria and BJ said earlier, turn off those cell phones. You're there one-on-one with your patient. Give them the attention that they deserve.
And I think healthcare professionals on the other side need to be a little bit more conscientious of that. You never know who you're going to meet when you walk into a room. And
Maria, how do you remove implicit bias? Or do any of you believe that there's such a thing as implicit bias? Do any of you believe that? I mean, when I say implicit bias, I mean when people are unconsciously influenced by the prejudice or stereotypes, you know.
Oh, I absolutely believe it exists. I think, and I've been the recipient of it, you know. So how do you remove it? I think the first step is for us to speak up. As patients, you have to speak up, because the whole point of it is saying it's implicit bias or it's unconscious bias. People aren't aware of it, and they've been doing it. For some of them, it's been throughout their whole practice, and no one ever says anything about it. Because I think you, as a patient, you're in a position where you might not feel empowered. And so part of it is something will happen and you're not really sure what happened until you get home and you think, did they just do that? Yeah. And so, but at that point, we talk to our family members and our friends and we complain, but we don't go back to the source. And so it continues to happen.
And that's important. That's important.
Right. And exactly what BJ says. Yeah, you have to bring it to their attention. If you notice it, say something, because if not, you're tolerating it. I mean, like you said, sometimes we go home, I said, did the doctor just say whatever? And I'm like, no, he didn't mean me, did he? But yeah, he meant me. I mean, you have to bring it to their attention or say something or ask the nurse, did he say that? You know, you have to advocate for yourself.
Well, I got some numbers for you guys, okay? We just keeping it real. I'm using an analysis of 330 million Americans, okay? When we're looking at medical doctors, 56.2% of the physicians practicing today are white. That would mean for every one white person, okay, for every one doctor, there's 400 people, okay? For your Asians, which is about 5.6% of our population, 17% physicians. So that will also mean, translated into, for every one Asian, okay, I mean, for every one Asian doctor, sorry, there's 125 people that he or she cares for. For every Hispanic, Rita, this is where we get this is pretty deep, okay?
Give me the numbers.
Okay, 18.5% of our population, okay? You only have 5.8% of physicians practicing, which would mean for every one doctor, you have 1,250 people. That's not good.
That's not good, but it sounds right.
African Americans, they got us right about 12.5, maybe 13% of the population, okay? Only 5% physicians, okay? So that means for every one doctor, there's 909, okay? Population, that's not good. American Indian and Alaska Native, the same thing. For one doctor, 909 patient population. Okay, then you've got a number here that they say is unknown, which is about 2.9%. I don't know what that means, okay? But they're saying that for every one doctor, there's 70 people. So I guess that would include all the other ethnicities that do not fall into categories. So when you guys are talking about talk up and say up, this and that and the other, I mean, it's kind of hard to find people that look like you. They're already burdened down, okay, with these high numbers. You say that I want to visit a physician, somebody that looks like me, although we know that when you're sick, a doctor will do. A doctor is a doctor. But say that I wanted to have someone that I felt more comfortable with. With the numbers that I've just given you, it's pretty difficult, isn't it? Anybody?
That's why it's so important for you to speak up on your own behalf. Those numbers are telling right there. So those people that say they intentionally seek out people that look just like them, it's harder for African Americans, Latino, Native Americans, people of color in general. So it is hard. So that's why you have to speak up and speak out for yourself and make these healthcare professionals of other persuasions, ethnic persuasions, do the best job that they're supposed to do for your health.
For you, because there are studies that show that doctors can hold negative stereotypes, you know, to patients without even realizing it.
Right.
Okay, which can make interactions unpleasant. Okay, and affect your total treatment plan.
But you have a right to healthcare. In the United States, you have a right to healthcare, and it's just, what are you going to do with that? The type of care that you're willing to accept.
Okay.
Yeah, and I think you also you have a right to effective health care. You know, the other thing is, one of the things that I've been listening to on the news is, you know, there is this push for education. There's a push to provide avenues for communities of color, particularly with even college tuition. What we have to do, I think, as a community is, on the one hand, individually advocate for ourselves. It has to start there so that we can maybe stop some of this continuous bias that people see now. But in the future, looking forward, we also have to start tracking our younger people, or even just people who are looking for a second career. If you're thinking about a second career, look at the healthcare. You know, maybe start off as a nurse assistant and build up, tracking them into math and science, and not just necessarily letting sports and entertainment seem to be the way out or the way up.
Yeah, we'll pay for entertainment and sports. We'll pay for that.
Yeah, I think also we need to put some of that burden back on the medical professions as well.
Absolutely.
As medical professions. I mean, if I go to the doctor and I don't speak English, I'm sure going to say, well, we're going to use the translator line. Can't you get someone? I mean, if enough people speak up, things will change. I mean, I visit a lot of doctors' offices because with the area that we're in, and I am seeing a difference in the offices where they have a multitude of people working. I mean, there's a spectrum of people working. There's people that speak Spanish, different languages. So they are starting to do that, but we have to hold them accountable too. They want their money.
Let me ask you something. Have you ever been in a physician's office, and this is just an example, okay, where there's nobody in there that looks like you?
Oh, yeah. Yeah.
Okay.
I was at a university and no one looked like me.
Okay, so that's a problem. And how does a patient or their family, what do they do in those situations? I mean, you know, the doctor, basically, you're that doctor's patient. Okay, so basically, do you think it's a wise choice to say, how come y'all don't have any Black people in here? How come y'all don't have any Hispanics? How come y'all don't have any Asians? You know, I mean, because if you've got people of a different ethnicity, it would be hard if I wanted to say something to one of the office staff if I didn't feel like they understood
Well,
me.
yeah. Well, if I didn't feel comfortable, I wouldn't be their patient. But if I felt comfortable and part of me is advocating for me and others, I would say, hey, what, you don't have anyone that speaks Spanish just in case someone needs Spanish or Cantonese or whatever? You know, it just can't be, I have to look out for me. We have to look out for each other. So if I'm going there because maybe it's just convenient for me because he's just down the street from me, I would advocate for myself, but also for others. So yeah, I would speak up. There's nothing wrong with that. If you never say anything, no one will ever know there's a problem, and everything will be shoved under the rug and saying, oh, everything's okay. No one has an issue that no one looks like you.
But what about competency? Didn't we have somebody that was a person on the street say it didn't matter to them as long as that person is competent? And that's really what you have to lean towards with those numbers. So of a medical professional looking like you.
But Maria, that patient was able to know what medical competency is. You understand what I'm trying to say? A lot of people are not there yet. A lot of patients are not there yet. They're not understanding what the doctor is saying. And I do believe that doctors should be able to talk to patients in more layman's terms. I think that's a part of their assessment. But
the compassion, though, at the same time. Yeah. A lot of these medical people get into it for a check. It's a calling.
Yeah, and but Cynthia, I do know that I know when I'm being discriminated against, though.
Yeah, you feel uncomfortable.
I mean, I feel uncomfortable. We don't have to have a PhD to know that.
Right.
But I mean, if it's not right, it's not right. If it doesn't feel right, it's not right.
And I think, you know, some of the things that we have to tell people is, what do I say? So if someone is dismissing you, I think you can say, Dr. X or Nurse X, I don't appreciate the way you're communicating with me or you're talking to me. That's very simple. Or I don't understand what you're saying. Please repeat that. You know, people are just afraid.
But I don't want you to know that I'm illiterate, that I'm ignorant in that way, that I really don't understand it. So
this is your health, Cindy.
Closed mouths don't get fed, right? You have to say something.
This is your health. And the things that we would challenge people on, you would challenge a waiter who didn't serve you correctly. We have got to stop thinking that our providers are not a part of our team, our health team.
And that they are not.
We're not a part of our own health team. So if you would not accept poor service from a waiter or a waitress in a restaurant, you shouldn't accept poor service from your healthcare provider.
Right. And you know, those doctors send those surveys out. Every insurance company has those surveys. They say, what kind of service are you getting from Dr. X? Is he meeting your expectations? What do the people at the office look like? Are they able to communicate with you?
But they don't ask them anything about ethnicity on those surveys. I've seen them.
Well,
they just ask them what type of care.
How do they communicate with them? Different types.
Okay.
You know, are they getting the services that they need? Do they get their answers of things they want? Those surveys are very important to a lot of these big companies because that's how they get paid, or the people get dinged. And that means they get money taken away from them.
Okay. So what type of advice then, Rita, would you give a patient who believes that they've experienced medical bias or racism? I mean, are there avenues? Are there organizations? Are there, how do I get it across? I haven't been treated fairly. And let me give you an example. Okay, say I'm a patient, don't feel like I've been treated with dignity and respect. And basically the doctor, they labeled me as a problem maker because I'm asking questions. Okay. And basically, the best way to get rid of this situation is to get rid of this patient. What avenues do I have? Now I'm leaving. I'm going to leave because I'm unhappy with him. But are there any avenues or any ways that I can express myself to any type of governmental entities or
And there is governmental entities that you can call, but we've been talking about this the whole time. Take some action. Speak up for yourself. Say, this behavior is not appropriate. I'm not going to allow you to speak to me that way. Or, you have to say something. Document what happened. Make sure that you know what's going on so they know, and file a complaint. You can file a complaint. If it's the doctor, he has a boss. If that's the insurance company, guess what? That's who you're going to file the complaint about. Just like Maria said, if your mouth stays shut, nothing's going to happen.
Yeah.
So there is entities out there. I mean, every state has different entities they can call, they can call or they can write to, but take some kind of action, because if we don't, it's like saying, it's okay, you can treat me like that. Because
and I can guarantee,
and I'm just going to leave quietly into the night.
Right. I can guarantee you, when it comes to paying that bill, okay,
right.
They won't have any problems communicating to you.
That's right. Because
how
if you
much
don't pay it,
and
they're going to look
you
for
need
you.
to have it in there. They're going to look for you, or they're going to tell you they can't see you until you get it.
They're going to affect your credit rating. Where's Scarsborough? They'll do something to your credit. I don't know what. But like I say, we've talked about it. Open your mouth. Say something. Say something. Because if we don't, it's like saying it's okay and it's allowed.
Yeah.
So, yeah.
Okay, so guys, I need your thoughts. Moving forward, what would you recommend to our listeners if they've experienced or believe that cultural bias exists from healthcare providers? What would your recommendation be to them? I mean, don't put up with 5 or 6 different office visits to where you constantly feel like you're being, marginalized. Okay. What do you think the best plan of action should be? Because this is about your health. So what do you think we should do? BJ.
Okay. The first thing I would say, and I'm still a firm believer of talking to the source first. I remember when I was at school, I hated when the whole class got dinged for something. It was this one person. So talk to the source first. If you don't feel that your grievances have been properly addressed, the next thing is to talk to the person that takes complaints. Whether you're in a private office or you're in a hospital, there is someone that is designated to take complaints for that patient. I think in the hospitals, there's a patient advocate. In the private facility, it might be the office manager. But there's somebody there that can document your complaint. And then, as Rita says, the next step is the source of funding. If you have insurance, talk to your insurance. Just simply say, I have a complaint, where do I go? They'll instruct you where to go. I am sure, man, Rita can tell me, Medicare, Medicaid, you can call the general number.
Right.
And then tell them what you want. They will tell you where to go.
Right. They'll guide you through the process. Yeah.
I mean, I would answer that on the opposite side, just have a message for healthcare people, just to remember cultural awareness. Right. You're treating the human body. You're not treating the outside. And that's the most important thing. Remember cultural awareness. It's so important. They even teach it to you in nursing school. So I'm very sure it's mentioned in the medical schools as well.
Yeah. And just like Maria and BJ both said, we all treat us like you would like you to be treated. Treat me if I was your mother. You wouldn't want anyone to abuse or neglect your mom or not provide the service they need. Sometimes that shoe is going to be on the other foot. One day you're going to be a patient too. And karma can be mean sometimes.
Well, Rita, a lot of patients express to me that it's about money. They don't even feel like they're being treated as a patient, more so as basically an avenue
for money,
or pay for money or a paycheck.
Avenue for revenue.
For revenue.
Avenue
That's right.
for revenue. You're right.
Right. So I think we need to get back to the compassion that we've always had. But I hear a lot of doctors say, "Well, I'm overworked. I've got a lot of patients." Well, I mean,
that's not my fault.
Hey, stop taking them. If you can't provide good care, and that's anyone.
Right.
If a nurse feels like she's had it, she can't do this job anymore, get out of the profession. Okay, right. Because you make it bad for people that are actually there to give good patient care and chose that profession not because of money, but because they primarily want to help people. And in some cases, these inequalities stem from structural and overt racism that goes way back decades and centuries, you know? So we have to do our best. And guys, and if you have any final thoughts, we're going to wrap it up today, because basically what we're saying to these people is that we can help you help yourself, okay? But we can't do it for you, that you've got to do it yourself. So any final comments?
Well, my first thing is to don't be afraid, because that, I think, is what paralyzes people and keeps them from asking those questions. So the first thing is don't be afraid. Speak up. I guarantee you, you will feel better being an advocate, and just start off with asking a few questions. You'll feel much better and more empowered than if you are a medical victim.
I like that. I like that. Okay. Rita?
Sorry, guys. Communicate effectively. We need to realize that we're all different in ways we perceive the world, and use that to understand our guide for communication. Just know that we're all different. We all communicate different, and we just need to be open to each other.
I like that. Maria?
Just again, pushing for my healthcare team, healthcare members, to be there for these patients and recognize cultural differences so that you can better assist patients.
All right. Well, we hope that you've enjoyed our show, and we look forward to you joining us next week on Kicking It with Kidneys.
Well, that's it for today. Thank you for listening to Kicking It with Kidneys with your host, Cindy Barclay. See you next week. The views expressed on this podcast are educational and opinion-based. These are not medical doctors.
Be sure to catch us on social media on our website, kickingitwithkidneys.com, also on Instagram, Facebook, and YouTube.